One.
All right, we are Corinne, Aria, and Heidi, and we did right heart failure. So for our patient history, our patient is a 58-year-old male. He presents in the ER with chest pain, shortness of breath, fainting, and feelings of irregular heartbeat. He has no prior conditions or health concerns, except that he is a smoker. He describes feeling extra stress from working as a construction worker and his at-home life. He has socioeconomic stress, family stress, and long hours with no days off all contribute to how much stress he is feeling. He also is the main provider of his family, which adds more stress to his work life. For pertinent anatomy and pathophysiology of the disease, of right heart failure, symptoms include irregular heartbeat, chest discomfort, breathlessness / shortness of breath, heart palpitations, coughing up pink or white foamy mucus, and body swelling, which is as the heart's right ventricle is too weak to pump enough blood to the lungs. Blood builds up in the veins and fluid gets pushed out into the tissues of the body, which makes other parts of the body swell, like the arms and legs.
So the diagnosis for our patient with right heart failure, in order to diagnose this condition, the doctor would order a chest x-ray, an electrocardiogram or an EKG, an echocardiogram, and some blood tests in order to diagnose right heart failure. And so a patient with right heart failure, their EKG results appear as a right axis deviation, a RS ratio of greater than 1 in V1, and the presence of P pulmonale. A high B-type natriuretic peptide is found through blood tests. The chest X-ray findings are cardiomyopathy, grade 1, 2, or 3 PVH, and an increased central systemic venous volume with an enlargement of mediastinal veins, including the azygos vein and pleural effusions. The echocardiogram shows diminished function of the right ventricle, and this all leads to the diagnosis of right heart failure for our patient. So the medical treatments for right heart failure include the doctors prescribing beta blockers to reduce heart rate, stress tests done prior to the start of the beta blockers. They recommend that this patient quit smoking, adopts a healthier diet, avoids caffeine and alcohol intake, less intense exercise, and stress management. If this patient worsens, treatment options may include an implant device such as a pacemaker or a CRT, an implantable cardioverter defibrillator, an ICD, or a left ventricle assist device, LVAD. Surgical interventions may be necessary, and they may include a coronary artery bypass, a valve replacement, or even a heart transplant. So a patient with right heart failure, it does cause some inability to engage in certain occupations. And so when this patient is participating in occupations, they may have a shortness of breath and fatigue that is inhibiting his ability to perform work occupations, pain from swelling in legs, making working and engaging in family participation difficult and painful. This patient may have discomfort, breathlessness, and tiredness while performing tasks such as leisure and physical activity. And this patient may have balance deficits and gait deviation in mobility.
So for occupations changing with the progression of this right heart failure, when exercising, the heart rate may not reach target heart rate when on beta blockers. The heart rate may be monitored while on beta blockers just for safety. And if there's excess fluid buildup, movements may become restricted and painful as swelling affects extremities. And the occupations that this impacts are family participation, work participation, physical activity, leisure activities, and health maintenance. Adaptive techniques and interventions. So an individual with right heart failure would engage in adaptive techniques and interventions as a part of their cardiac rehab treatments. And this is including but not limited to walking, cycling, rowing, yoga, jogging, and strength building resistance training. And some lifestyle modification and support suggestions would be education about management of high blood pressure, diabetes, high cholesterol, and obesity, mental health counseling for anxiety and depression, and a suggestion of taking more frequent breaks and shorter work shifts with less strenuous work tasks. So instead of showing a visual image of what our intervention looks like, I found a good video clip of what cardiac rehab encapsulates and the different things that they work on. So I'm just going to show this real quick.
The center's medical directors regularly review your progress in the program to ensure a healthy recovery and improved fitness levels. The cardiac rehab staff is part of your healthcare team and regularly shares information with all your primary providers.
The in-house program and the home-based program, both of which I thought had a great value for me. Initially, the work in here at the gym helped to establish the routine. At the home-based program with David, I was able to get me a very full level workout and work with whatever I had available, depending on whether I was at work or at home.
With both the center-based and home-based programs, you will have the opportunity to meet with our cardiac rehab registered dietitian, pharmacist, and psychiatrist. Our dietitian provides the most current nutrition information and coaching to help you make changes that meet your goals of a healthy body. The pharmacist provides medication education and ensures your medication treatment is optimized. The psychiatrist focuses on stress reduction counseling to help you identify and tackle everyday sources of stress, which are known to contribute to heart disease.
So as we saw in this video, many different professionals work together as a team in cardiac rehab. We saw cycling and strength resistance training. We also saw education and like pharmaceutical support and psychological support as well. And these would all be beneficial toward the intervention for an individual with right heart failure.
The center's medical.
And these are our references. Thank you.